Dr. David Samadi from Lenox Hill Hospital, and we're bringing you the latest medical news, world health news from all over the world. And we have all different type of topics, from technology to science from other countries. Now we have one of my favorite anchors from NY1. You all know her, and she doesn't really need any introduction. Roma Torre is online with us. Good morning, Roma. Dr. Samadi here. How are you?
Good morning to you, Dr. Samadi. It's a pleasure to be speaking with you.
I really appreciate you sharing your Sunday morning with us. I know you have a very strong message, and I want to really bring it to life. Life was great for you. You were going to work every day. You were doing your job as an anchor. We all enjoyed you on TV, and I'm your biggest fan. And then comes the news of colon cancer, and life changed. Tell us about that a little bit.
Well, I had always been told by my doctors that when you turn 50, you really ought to go get a colonoscopy. It's just a routine screening. And when I did turn 50 several years ago, I was reluctant to do it because I had no family history and I didn't have any symptoms. I lived fairly healthy life. I exercise regularly. I eat well, and again, there were no symptoms. So I thought, well, I could put this off, and I put it off for several years. And I finally, actually, a colleague of mine had mentioned he had done it, and I thought, okay, well, maybe it's time. And I went in there getting the colonoscopy, thinking it would be, no big deal. And then I came out of the anesthesia, and the doctor, or the gastroenterologist, greeted me, and he had sort of a serious look on his face, and I'm thinking, well, what's this all about? And then he started saying those words, large polyp, couldn't remove it, biopsy, and it took me back, certainly, and I said, biopsy? And I said, well, it's benign, right? And he didn't say malignant, but it didn't look good. And then, right after that, several days later, I went back to him, and the biopsy came back with a malignant tumor there that had to be surgically removed. And it devastated me, as it would, I'm sure, most of your listeners. It was really a horrible piece of news to learn midstream in life. But, I went through the motions, and fortunately, it turned out all right for me.
And how do you feel today?
I feel terrific. I know that you're never really considered cancer-free until, I think, you're the doctor, but I think it's like 5 years if you stay clear. And so hopefully that will be the case for myself. But right now, I feel terrific.
I studied some of your story, obviously. I always prepare before we come. And you have, from what I understand, stage 2 colon cancer, and it was done laparoscopically with a great success. And they didn't think that you need radiation or chemo, even though, if God forbid it ever comes back, those options are available. Is that accurate?
Yes, that is accurate. And that was a very nice piece of news that I learned about a week or two after the surgery, that I didn't need any further treatment.